thinks that I could rub the pain away, and it didn't work. So after 3 months, I got the clue that the pain was not going to go away, and that I was going to have to do something. And when it got so bad I couldn't walk on the leg anymore, I got scared, and I called my orthopedic guy and I said, "Look, I got this problem." And he said, "Get an X-ray, come in." When he saw me, he said, "No more walking." And he read the X-ray, get an MRI, and get down to an expert. So that was the path I took.
So when your doctor told you you had 8 years, like what did you say? Or
I
what was
thought
your reaction?
I thought it was a pretty good amount of time because I am 77 years old and 8 years is a long time for me. The only problem with it is you know that you only have so much time, and knowing that makes it a lot scarier than when you don't know. When you're living a normal life, you don't know when you're going to die. In my case, I do know that I have 8 years. It might be less than 8 years. It could be 2 more years, more than eight, which would be 10. But I'm not sure of that. So it's a definite time period. So you know whatever you're going to have to do, you've got to do it within that time period, and it puts a little bit more pressure on you.
Okay, so when he told you that you had multiple myeloma and there's no cause or no cure and you have no idea like where you got this disease, like who did you think of? And like who did you think would be most affected?
I thought your mom would be most effective. I thought of my grandchildren. I worried that this is something that will pass down because they say it's environmental. I don't understand what the word environmental means. How does it affect me? Where in the environment is this mysterious thing that got me in this situation? So I would like more information. I don't know whether they have it. I will keep searching for it. I am thankful that it is curable. I am also thankful that it is not contagious. Uh, I'm not happy with it, but if I have anybody who has it or gets it, they can have that bone marrow transplant operation done. And I understand that your siblings are the ones who can donate the bone marrow, and that the donation is not really, really, really horrific. The operation for the patient is much more serious than the actual donation of the bone marrow. So it's definitely out there. It's possible people are getting it, and if you can't get it from a sibling, you can go on a. I'm sure there's a hotline someplace where you can go, but the donors are going to be few and far between, and the ones that will be good for you will be even more than few and far between. So that's a small option, but it is still a good option.
All right. Since there's no known cause, but like a high risk factor is like environmental, but also it's like metal from replacements. Do you think you got this disease because of your knee replacements and your shoulder replacement?
I'm sure that that's a real good possibility. I had this knee replacement done in my 50s. I have had this one done maybe 5 years later. The right was done first, the left was done 5 years later. Then I had a shoulder replacement, and I think every time you put something in your body that is not part of your body, it does something to you, and that's the chance you take. I mean, I wouldn't have been able to walk from the age of 50, so I took that chance. And if this is what I have to deal with, then that's it.
So, what would you say is the hardest thing about this experience?
The hardest thing is knowing that you have a limited amount of time, and the reaction of my daughter when she cried and when she asked, "Is it hereditary?" No mother wants to leave a disease to their children, and that was the hardest thing for me.
Describe your pain at its worst.
Well, if you can't walk, it's pretty bad. And I was at work and I wanted to go home, so the pain was awful. It was awful. It was horrific. I mean, every step was horrific, and you know that you're there's a chance that you'll get to a point where you will maybe fall down and then you can't get up. So you have to get to where you're going and stay there until you can solve the problem.
Is your pain only isolated in the right leg, or does it spread throughout your body?
That's a real good question. In the beginning, it was on my. I had a PET scan, and they saw spots of cancer on my ribs and on that right femur. The rib pain went away, and the right femur still hurts a little bit. So I'm going to say that because I'm putting constant pressure on it, and I've started to gain weight from the chemo, which is not good. That is what makes that leg hurt just a little bit. There's no pain in the ribs, thank God. That pain disappeared, and I hope it stays that way.
Are you scared?
Very scared, very scared. I didn't think I would die from cancer. All the people around me that I watched died from heart problems. And I really thought my problem would be with the heart. I actually thought, oh, that's fast. It just stops beating and then you're done, you know. But it's not happening that way for me, and I don't understand why. But I have started thinking about all the relatives in both sides of my family, and on my father's side, my uncle died from brain cancer. So there is a strain of cancer in my father's side of the family. So I kind of know where it came from. And his sister died from a blood type cancer. So I think I know where this cancer came from. It came from the Schaller side of the family. And I've reconciled myself to the idea that that's the way I'm going. My mother's side of the family all had heart attacks.
What do you think the future is going to bring for you and for our family?
I am hoping that I will be able to walk right up until the last day of my life. I asked the doctor that the other day, and Dr. Lebovic is a good doctor. He will not give you any false information, and he's very cautious. But he said he does not know. He does not have any answer, but he works very ambitiously trying to keep me well and trying to medicate me in a way that I will be well. So I am going to rely on him. My daughter knows him very well. She thinks he's a very good doctor. She said he has excellent um, mannerisms with his patients, and she's just very happy with the way he treats his patients, and I am too. So I am going to rely on him, hope that he gets more and more educated as he goes along in this business, and that we'll both survive at least 8 to 10 years.
So, are you scared that your legs are going to be compromised and you're going to end up in a wheelchair? Do you think that's what your future is going to bring?
That's an absolute worry. That's an absolute worry, and that's God's will. There's nothing that I can do about that. All I can do is do what I'm told, go for the treatment, pray a lot, and hope that God will see that I can walk right up until the end. That's my prayer. That's my real wish in life, is that I do not become handicapped and a burden on somebody.
What is this disease to you?
It's a great awakening. I never thought of cancer. I just thought cancer was going to pass me by. I don't know why. I don't know why. I didn't get breast cancer, so I thought, okay, I'm not a cancer. So I'm not going to get cancer. And I just didn't realize that it can come in many different ways. And I am very, very lucky it did not hit an organ. If it hits an organ, you have a limited amount of time to live. He's given me a lot of years, so that gives me a lot of time to work at it and to do all the things that I need to do to make myself happy before I die, and make and not to leave any closed doors before I die. And I'm happy that if I'm going to die from a cancer, this is not the worst cancer that I could die from. I don't think it's painful, but I don't know. I haven't found anybody yet that had any experience with it, and the doctor sure is not telling me. He's being very careful and telling me I have 8 years, 8 good years, and now he added 2 more. So I'm going with that, and I'm going to pray that it's not painful, and I don't really have an answer of how I'm going to die. I wished I knew, but I don't really know.
So you trust him that you have 10 or 8 to 10 good years?
I trust him that I have maybe 6 to 8. That's what I'm thinking. More like 6 to 8. That's what I trust because of my age. I'm kind of old to live another 8 years, and especially with cancer of the blood. The blood's circulating through your whole body. So if there's any weakness here, I always feel like the blood will hit it and it'll, something will happen. But he's not telling me that. He's telling me that, whatever treatment I'm getting, as long as I come every other week, I'll be okay. So that's what I'm believing in, and that's what I'm holding on to.
So because it's a blood cancer and it also impacts like your immune system, do you think getting the shingles was a warning?
I think the shingles was a big part of it. Yeah, I do, and I'm so sorry I didn't get the shingle shot. I tell everybody now, get the shingle shot because it's a terrible disease. Shingles is a really, really, really terrible thing.
Does your doctor think it has anything to do with it?
He never even discussed it with me. No, he doesn't even think about that. They just go from the femur, from the biopsy forward. No discussion about the shingles because that's pie in the sky to them. That's just like a guess, and I don't think they like to guess. I think they like to tell you whatever hard facts they have, and if they don't have them, then they give you a word like environmental and let you figure it out or let you think what you want to think.
So for your diagnosis and your diagnostic testing, you had to do the MRI, the X-ray, the biopsy, and you got the PET scan. Can you explain all those?
Well, the X-ray is an X-ray. It just showed them the lesion on the leg. It wasn't enough for Dr. Lockman, who was going to do the surgery. He wanted the MRI. I brought the MRI into him. Then when I was at Cooper, they did the PET scan. They gave me as much testing as they needed to perform that surgery, and he told me when he would take that biopsy, he would literally walk it to the lab and have them diagnose it while he was operating or in the middle of the operation, so he would know exactly what to do for me. I really felt as though he was probably the best surgeon that I've ever been exposed to, and I believed everything he told me, especially because he was so worried who was going to treat me. He wanted my treatment to be at Cooper at MD Anderson, and I said to him, it's really far away, and I could go to St. Mary's a lot easier, and I know Dr. Lebovic, and he said, oh, I know him too from U of P. You can go there. It's okay. I can't think of anything else to say about it.
So, since you don't go to a support group, you would say your doctors are your main support and your family?
Absolutely. The doctor gives us a monthly visit. We go in, we discuss everything. He brings his computer with him. He shows us how the blood is progressing, how the levels are going down, which is good in this particular case. He discusses everything, and we ask all our questions. So a monthly visit with the doctor, I think, is the best thing that could be, because if you have a problem, you can discuss it with him, and he's right there, and he really cares about his patients. He really does. He gives his all to his patients. He's very good.
Did he give you a stage? Like smoldering, stage 1, stage 2, stage 3?
This cancer is stage 3 for me. So I have a feeling that I had it for a while. I have a feeling that I was in stage 1 and 2 for a while. And I think the shingles might have brought it out and would have caused this pain, which caused me to go to a doctor. Because I'm not running to specialists. I'm just going to regular doctors. And they, again, with all the metal, I mean, how do they test that? I don't think they have tests for that. So this is what it is, environmental. Key word, environmental.